All right. Good morning, good afternoon, good evening, depending on what time of day you're watching this. You're either watching it live right now on Zoom or on Facebook, or you may be watching the recording. We've been doing this series now for a little while, and so there may be some of you that want to see some of the other parts of the series. So definitely subscribe to the channel, Time to Tell the Truth series, weekly series, where we try to help anybody understand truths about things that we maybe have never heard of as it relates to our health and wellness. Well, my name is Dr. Roz. That's what mostly people call me. My full name is Dr. Rosalind Shaw Belt. I am the CEO of Dream to Life Productions Ministry, LLC, incorporated nonprofit. I am a wife. I am a musician, but done a bunch of other stuff. But here's what's important. I do have two doctorates, not a medical doctor, two doctorates, one in theology and divinity. But what's really important in this session that we're a part of right now is that I'm a certified wellness coach. I've got some credentials as it relates to that. One, certified economopreneur and lifestyle consultant, and the other, Flat Belly Lifestyle 2.0 with our illustrious naturopathic doctor, Dr. Eric Prince. So let's get to part two. Last week we talked about what they don't teach in medical school. So many things that we don't recognize, and sometimes we have problems with what we're hearing, or we don't get the whole truth and nothing but the truth when we go to see the doctor. And we talked about even the pressure sometimes that is up on their lives, the stresses and the just burnout that sometimes they experience. But one of the things, and let's get into part two. So if you want to hear those things about part one of that, then you'll have to go back and listen to the pre-recording from last week. But one of the things that they don't teach in medical school is about real patient experiences. Real patient experiences. What do we mean by that? Well, patients don't always follow the book. Medical school teaches textbooks cases, but in not necessarily in real life. And so when you're a patient and you come to the doctor, we have some complex social issues. We've got some stuff that's going on. And a lot of time we talked about last week is we sometimes recognize what we feel in our body. And maybe because it doesn't line up with what the book says, all of a sudden it's ignored. So many patients have said, I'm feeling this. But because you don't find it or you don't recognize it as something that you've been taught, it's sometimes just ignored. And that patient actually knew what it was. And so most of the time, they're not taught about those real patient experiences because it's not compliant. And so many doctors oftentimes are non-compliant, mistrustful, or suffering themselves emotionally, not experienced in food deserts and racism and housing situations and income, not covered, but deeply it affects the outcome of a patient. So there's a necessary thing that needs to be done to understand communities, right? You know, back in the day, the doctor used to come to your house, right? The doctor used to come to your house and they knew your family and they knew what was going on in your household. It went further than just the 5 or 10 minutes or that you're looking at your watch, 15 minutes, got to get to the next patient. So those real patient experiences are really important. Also, health disparities, social determinants. See, there are true factors that are related to our health. It's not all just about science. There are factors like poverty and racism and housing, food access that's often overlooked because if you recognize it in certain neighborhoods, there's only certain kinds of food. So many times we're just given just the medication and not considering, really not considering even what zip code somebody lives in, because whether you know it or not, we've done a previous teaching about how certain foods are related to certain zip codes. I mean, and that's just the way it is. You got certain grocery stores that are certain kinds of ways in certain zip codes. They have a certain quality of food. So that's not being taught in medical school, but that's a reality. So we need more integrative education, more emotional intelligence. We need preventive and lifestyle training and we need business and finance skills.
Number 7. Number 7, the placebo effect. Now, we're taught the placebo effect in terms of the gold standard for clinical trials, which is a random control trial. Okay, we're taught in that sense. But what we're not taught is this. In most studies, the reason why they use a placebo in the golden standard, the gold standard for a clinical trial, they use a placebo because in many cases, the placebo, them getting, all right, so let me give you a little bit of explanation. So if somebody's coming out with a new therapy, a drug, right? They'll have the new drug that they're coming out with, and then they'll have another capsule that looks exactly like it, but it's got sugar in there, okay? So the capsules look exactly alike, and they'll randomize it because a randomized controlled trial, they have to randomize who gets what. All right. Now they know who gets what in many cases in certain trials. All right. So this person got the placebo, the sugar pill. This person got the new drug. Okay. You know what they've discovered in many of those trials is that people take the placebo, just a sugar pill, nothing in there. They take that and get better. As a matter of fact, they did it with antidepressant medications, and the placebo effect actually did better than the medications in many cases. And as a matter of fact, just to show you the placebo effect is real, they have did this with surgeries as well too. So let's say somebody was getting a knee surgery and they were supposed to get a total knee surgery, right? A total reconstructive knee, all right, or hip surgery. The doctor would actually do the incision, but for the placebo, he would not actually do the surgery. So the patient would actually see there was a cut and that it was sewn up. So for the placebo, they did nothing. Then for the other patients, they did the actual surgery, the total reconstructive surgery. Guess what? In people who literally had no cartilage, bone on bone, in some of those people, they still improved. Their pain levels went down exponentially. Now, why am I bringing that up? What it says is we have the ability to think ourselves into health. We have the ability to use our mind and our thoughts to heal ourselves. All right? That's scientific proof. So if that's the case, I know we're taught about it in randomized controlled trials, but we're not taught about how we use the mind to actually heal ourselves. As a matter of fact, another case in point was a patient who actually, got cancer. And the doctor gave him literally a couple months to live. So he decided he was going to go home and do laughter therapy. You know, if I'm going to die, I'm going to spend the last days of my life laughing. Watch all comedies, things that made him laugh for a couple of months. Guess what? The cancer went into remission. So the point I'm trying to make to you guys, we're far more powerful than we know. And in addition to that, our minds are capable of healing ourselves too. So it plays a huge part in terms of like the treatment or therapy that we should be actually talking to patients with. We should actually be giving them a mental approach to healing themselves as well too. All right. But instead we give them the diagnosis and the doomsday, response. And instead of thinking themselves in to health, they end up thinking themselves into death. And that's been also an interesting study as well too. There were patients who were misdiagnosed. They were misdiagnosed and told they had cancer, but the labs got switched and they didn't know it. And so this patient was told they had cancer, but they actually didn't. It was another patient's labs. This patient went home and a couple months later actually had developed cancer. So we could do it in both directions. Hugely important.
So now, here's what's so powerful about that. What Dr. Bobby Price, and for those of you that don't know who he is, definitely listen to part one of this where we discussed letting you know exactly what his background is as a pharmacist and medical doctor and all of that into pharmacy, and worked with the FDA for a season, and then now is completely holistic. But here's what's so powerful about what he said. He's talking about scripture. As a man thinketh in his heart, so is he, right? He's also talking about scripture when the scripture says laughter does good like medicine. So this person laughed themselves to the healing. And the same thing took place when that person was misdiagnosed. And now they're going home mentally thinking, I'm going to die, I'm sick in my body. And guess what? It manifests. So that's why something that they don't teach in medical school is something that we need to focus on. If you've got a person that's in the hospital or sick in their bodies, one of the things you want to always do is keep a positive environment around them at all times. No negativity, no doom and gloom, no family coming in already writing it off, seeing when they're going to check out of here. You're getting the wheel ready and when am I going to be left? No. It's all about focusing on positivity. Because I can talk about a real testimony. When my mother passed away, one of the things that she said just before she passed away, I don't want that doctor to touch me anymore. She had made it up in her mind. I don't want that doctor, because they had done some things she wasn't in agreement with, but she was under a lot of medication and didn't know it. And some decisions had to be made. I don't want him to touch me anymore. And guess what happened? The doctor came in and touched her and she passed away. So there's so much power that needs to be taught along with, but sometimes all they want to teach us is take this pill and take that pill. So see, doctors learn how to save lives, but not always how to improve them. Now, again, I'm going to go and my disclaimer, I'm not talking about all doctors. I'm not throwing every doctor under the bus. But there's so many cases that it's about exposing the gaps. Because when you understand what your doctor wasn't taught, then this is not really about the doctors as much as it is about you taking back your power. It's time for every one of us to take back our power, because the uncomfortable truth is that while individual doctors and nurses often care deeply, especially the ones that realize this is a calling. Now, there's some that it's not even a calling at all. They're just in for the money. They're in because they've been to school 8-10 years and they're ready to make a buck and get you through the system. But let's just talk about the whole system. The healthcare system is built on different sets of incentives. There are some legitimate doctors and nurses out there that definitely care about their patients, care about people, care about saving lives, care about helping. But there's a breakdown of why the healthcare industry as a whole does not prioritize real health. The healthcare system really does not care about you getting truly well. Otherwise, one of the first things we taught last week, they would teach you about nutrition. They would tell us, they would ask us, the first thing they would ask us when we get in that chair or when we visit that doctor, what are you eating? What are you putting in your body? What are you doing that's destroying your life over time? And there's a reason, okay? So let's talk about the reason why the healthcare system is really built on a different set of incentives and why they really don't prioritize health. It really shouldn't be called healthcare. It should be called critical care, because that's when people are concerned, when we become critical. And why? Because sickness is not profitable. Excuse me, sickness is profitable, health isn't. It's not profitable. It's not profitable if you don't need a pill. Sickness is what's profitable. The industry makes the most money when you are chronically ill, but you're still functioning. Oh yeah, they want you to live a long time taking the pill. They want you to live a long time on dialysis. They want you to live a long time saying you have high blood pressure and diabetes and sickle cell and et cetera, et cetera, et cetera. They don't want you to die. They want you to live a long time, but be sick. That's profitable, Because then what? You need medication, you need tests, you need repeat visits. If that's why they shut down people when they come up with a cure for cancer, or when they come up with a cure for diabetes, or for other situations. When you come up with, when you say you've come up with a cure, they shut you down, because a cured healthy person is no longer a customer. There's no profit. There's no profit in prevention. Oh, we're starting to hear a little bit more about prevention, but that's not really what the healthcare system is built on. So that's a common critique of our healthcare system. I was just in a conversation with someone today that has spent years in Canada, where everything in the healthcare system is taken care of, and you get completely taken care of. And see, when we see these other countries who don't have the kind of sickness in people's lives, in different parts of society, in our neighborhoods, when you don't see that happening in Japan and all these other countries, why? There's a reason behind that. Because sickness is profitable. Healthcare isn't. I mean, here's some facts. United States healthcare industry is worth over $4.5 trillion. That's with the T, guys. According to the Centers for Medicare and Medicaid, United States healthcare spending reached $4.5 trillion in 2022. That's about $13,500 per person. Much of this goes to treating chronic diseases, not preventing it. And the medication does not prevent it, it treats it. It's like being in your vehicle. It's like actually being in your car and you see a check engine light on, and you go underneath there and you disconnect it. Is the problem gone? No. You just don't see the warning signal anymore. And that's what medication does. It turns off the warning signal, but we still have the diabetes. We still have the high blood pressure. We still have all of these chronic issues going on in our body. You know, they just put it at bay. They just put a Band-Aid on it. Number two, 90% of healthcare spending is on what? Chronic conditions. And according to the CDC, 90% of the United States, $4.5 trillion in healthcare costs go toward chronic and mental health conditions, diseases that are often preventable or reversible through lifestyle changes. We have certain things that are going on now in our communities and in our lifestyles, like diabetes, like high blood pressure, like dementia, like Alzheimer's. All these things are taking place, and they're becoming the norm. And nobody's telling us that they were preventable. There were things I could have done in my life through my diet, through my nutrition, that I did not have to go down this direction. But now we live in a society, especially in our neighborhoods. I mean, that's often $4 trillion per year just to manage illness like diabetes, heart disease, cancer, obesity, and autoimmune conditions. Number three, pharmaceutical profits are among the highest. Big Pharma's making the money because sickness is profitable. The top 10 pharmaceutical companies made over $700 billion in revenue. And that was in 2022. This is information I got in 2022. What's taking place right now? All it does is increase. Example, Pfizer made $100 billion in 2022, largely from COVID-related treatment. Who was affected the most by COVID? Those that had high blood pressure, diabetes, those whose immune systems were compromised. And many of those drugs, and we know we're living in an economy right now where they're trying to take away the benefits of prescription drugs and some things, so people are having to pay full price for them. When I work as an insurance agent dealing with my Medicare clients, that's the hardest situation, to decide, do I pay the light bill or do I buy my drugs? You know, and now with all the different things that have been taken away, it's getting worse and worse. So many drugs are priced at 300 to 1,000% markup. And yet you see the commercials on TV. Guys, do you realize that we're the only country that allows commercials about pharmaceuticals? That's not allowed in other countries. Why? Because a commercial is designed for you to go get it, right? Well, you can't go get a pharmaceutical drug unless it's prescribed. So now you get it in your head because of subliminal suggestion that, oh, here's a new pharmaceutical drug. And then when you go to your doctor, what do? You ask him about it. You ask the doctor about it because they haven't even brought it up. But because now subliminal suggestion from a commercial is making you say, well, should I take that? Maybe I need to check with my doc, because you can't go get it off the counter because it has to be prescribed. So many of the drugs are priced 300 to 1,000% markup, and yet curative or preventative alternatives receive little to no funding. When's the last time you saw an apple in that line going to the checkout counter? No, but you see all kinds of candies, everything that's got sugar in it, everything that's literally killing us over time.
If you think the pharmaceutical industry is all about making us healthy, think again. It's time to pull back the curtain. Picture this. You're a big pharma company, your biggest moneymaker. It's not a cure, it's a treatment. That's right, folks. Keeping you coming back for more is where the real dollars are at. Pharmaceutical profits are sky high, higher than almost any other industry. We're talking billions with a B. And guess what? They've got a vested interest in ensuring you stay just sick enough to need their products. Think about it. If everyone were healthy, who'd buy their meds? Curing diseases might just put them out of business. This isn't a conspiracy theory, it's simple economics. So next time you see that ad for the latest wonder drug, ask yourself, is this about making me better or just making them richer? Stay curious, stay informed, and always read the fine print, because your health shouldn't be their profit margin.
But we're living in a season, in a time where it's been that way for a long period of time. Now, it wasn't always that way, because back in the day, remember, your great-great-grandparents used to go to the backyard and pull something up from the ground? But here's the thing about plants, and we heard Dr. Price talk about this last week. Anything that's a plant, you can't put a dollar sign on because it's natural. It's God. It came from God. It's what God has allowed to grow, right? The other thing that makes sicknesses profitable, because doctors and hospitals are paid more to treat than to prevent. I mean, that just makes sense. They're reimbursed. I tell my clients all the time, watch it when the doctor always has a free thing that they can give you. They're reimbursed by the insurance company for prescribing medications, for ordering procedures, for managing symptoms. And most of us get our bills and we don't even look at them closely, because sometimes you're overcharged, you're multiple charged for things that you didn't even purchase. You're charged, you got duplicate charges. I used to work with a company that we look for those duplicate charges, and we could bring people's bills down drastically. Because you went to surgery and you were charged by this doctor and that doctor and that doctor. You didn't even see that doctor. And then you were charged for gloves, and then you charged for a kit that already had gloves in it. They're reimbursed by the insurance company for ordering procedures and managing symptoms. They are not reimbursed at the same level for nutrition counseling, for lifestyle coaching, and for preventative interventions. And then only 3% of the healthcare spending goes to prevention. Only 3%. Now we start hearing they'll give you a gift card if you come in early, but it's not stressed. It's not even stressed that prevention is the way to go. Despite the billions spent on managing disease, less than 3% of the total healthcare dollars are spent on preventative care and public health. You do the research. That's all I've done, is do the research. So the final reality is the system isn't designed to make people well. Let's wake up. Let's wake up and take control of our lives, take control of our bodies. It's designed to manage illness indefinitely. I'm going to say it again. They want you sick a long time. They do not want you to die because that's what generates ongoing revenue. So when they say that our life expectancy has increased, yeah, sure it has. Sure, people are living to be 90s and in their hundreds, but are they well? If you're like me, I want to live. I want to live a long life. But I don't want to live it and you're pushing me in a wheelchair, or living in I don't have my cognition, or living it and I can't feed myself. So why the healthcare industry doesn't prioritize real health? Another reason they don't really care about you getting well is the system is built for management, not reversal. And they get rid of anybody, and I said it just like that, get rid of anybody that's talking about reversal. Doctors like Dr. Sebi back in the day, and there's a list of doctors, when they start saying it can be reversed, whatever it is that you're dealing with, and they've had proof, they've had testimony after testimony after testimony after testimony of people that have had certain things, but because they changed their lifestyle, they did certain things, they started using herbs, they started getting things from the ground that God made, plants that God made, and it was reversed. You don't hear that. They get rid of it. They want to stop that. They may want to stop this right here, what I'm doing. But doctors are trained to manage symptoms, not find or fix root causes. Chronic illnesses like diabetes, hypertension, autoimmune diseases, they're rarely addressed at the root because there's little training and even less incentive. Guess what? You don't have to be a diabetic. And I'm challenging every person that says they're diabetic to stop saying it. You can say that I'm wrestling with diabetes, or I've been affected by diabetes, or I've been diagnosed with diabetes, but don't call yourself a diabetic. I have high blood pressure. No, you just have a problem with what you're eating, really. That's the bottom line. Put the responsibility where it is. The responsibility is on us. We don't have to have these kinds of diseases and autoimmune diseases, and they're running rampant. They're higher, and we've shown you statistics last time of what they look like in the African American community.
Would you say that America is a healthy country? Is what we're doing for healthcare today really working for us, or is it working against us? Over the last few years, our life expectancy has gone down for the first time in history. This will be the first generation that lives a shorter, sicker life than their parents if we don't change something now. And this is absolutely crazy to think about with all the modern advancements we've had in medicine and the diagnostics that should be helping us to live 100 healthy, energetic years. But the root of the problem is access, including access to testing, access to diagnostics that can tell us what our bodies need and when they need something new, which is what we've built with Function to solve. Sick systems create sick bodies. We don't have a healthcare system. We have a sick care system, meaning it's designed to treat people who are already sick, not designed to keep and make people healthy. It doesn't help that so much of our so-called food is poison, or that our environment is practically choking on itself with toxins. Much of the legacy health system today was built during the same generation as fast food. We're living in a world with more toxins in our air and water, more sugar in our food, and more hormone-altering stress from our always-on phones. It's time for a new type of healthcare, one that starts with you, placing you at the center of this new system, empowers you to own your health outside the doctor's office, which is where real health is created.
And see, here's the thing. You don't have to necessarily become a vegetarian or a pescatarian or any kind of tarian. If that's what you want to do, that's what you want to do. But that's not necessarily the issue. It's about being more intentional. I tell people just to start somewhere. Recognize, read the label. Stop eating everything all the time that has 16 ingredients in it. Am I saying not have a good time? Oh, enjoy yourself. Yeah, we've got certain habits that we just love to have. And really, we had another session where we talked about how we're just addicted to certain things. And we've been programmed to think that if you eat healthy, it doesn't taste good. That's the biggest lie we've ever been told. Because healthy food can taste really, really good. I tell people it's all in the seasoning, okay? But we got to recognize we've been hoodwinked, we've been bamboozled. And these hospitals and pharma are businesses. Big pharma insurance companies and hospitals are profit driven. They answer to the shareholders, not to the patients. Prescription drugs, surgeries, treatments, that's revenue stream. Preventative care, food education, lifestyle changes, that's not revenue streams. They're not making any money off of it. So they want to keep us in the same space of where our health is, and that's to be sick. And then research favors what can be patented. I said this a few minutes ago. You can't patent nutrients, plants. You can't patent what God has already made. But synthetic drugs, what they create in a lab, that's what can be patented. So the research dollars flow toward things that generate future profit, not what gets people off of meds. Hear me when I say, I am not promoting you to go ahead and ditch all your medications. But I am saying to you, take a look at what you're doing and recognize there are some other options that maybe nobody's telling you about. There's an option to being, my parents took high blood pressure all of their adult lives. But when my father passed away, he was on dialysis, and it wasn't because he didn't drink water or because of other things like that. It was because of the high blood pressure medication that he was on for so many years that eventually did damage to his kidneys. How many stories are we hearing like that? So there's no incentive for long-term outcomes, none whatsoever in our healthcare industry. Providers are often reimbursed for visits and procedures and prescriptions, not for actually helping patients stay well over time. Your doctor wants to see you, right? And then the system trains dependence. It trains you having the pill capsule with this is what you take, this is what you take here, and this is what you take at this time, and this is what and for you being dependent on that. And when you're dependent on that, you're dependent on that. Your body ends up being dependent on that. Not empowered to take ownership of your health. I hope that this will make you think and say, I'm going to take control of my own life. Words like reversal, detox, natural healing, are even treated with skepticism. Talking about, oh, that's unscientific. There's no science behind that. Oh, but there's a lot of testimonies behind it. When a person begins to recognize that it can be reversed or that they can detox their body and get these toxins out of our body, despite there's evidence. So the final thought in this, why the healthcare industry doesn't prioritize real health or you getting truly well, is that the healthcare industry isn't necessarily trying to hurt you, but it's not designed to heal you either. It's designed to treat you just enough to keep you coming back. True health comes from empowerment, education, prevention. And that's why it's up to us to lead the change. That's why I hope it's up to you to share this information with somebody else that maybe a little light bulb will turn on and say, you know, I can do better than this. I can do something about this. I can become more intentional. Or at least know what you're doing when you do it. Even if you just keep doing it, just don't do it in the blind.
Number 8, we're not taught the body's innate ability to heal itself. This is why we've created a pill for every ill. We don't lean into the body's capabilities, the body's ability to use angiogenesis, the body's ability to use it, stimulate stem cells, okay? Using the body's immune system, okay? Instead of using antibiotics and chemo as a first line therapy. The microbiome that I touched on before and how important it is. Autophagy, which is intracellular cleansing that gets rid of dead cells and waste out of the body so that they don't develop into disease and cancer. We're not taught how to stimulate the body's natural ability to heal. And there are things that we can do to stimulate the body's natural ability to heal other than food. But we're not taught those things. So the first thing we do is take a whole bunch of antibiotics, throw it on you, and guess what? That not only kills your microbiome in your body, okay, but it kills a whole lot of other things that are very important too. We take chemo, boom, throw it into the body to fight off cancer, but guess what? Chemo is not distinctive. It kills both cancerous cells and healthy cells as well too. So instead of our approach being, how do we stimulate the body's natural ability? Because the idea, if you have cancer, your cancer is going to be one of the body's primary way of fighting cancer is our immune system. What are we taught to teach our patients to stimulate their immune system? We don't teach them much.
I personally know people that have had cancer, and their cancer's in remission, and it didn't go in remission because of the chemo or the radiology. They changed their lifestyle. They started doing some things different. They started eating certain foods that went against those cancer cells. There's a whole teaching that I did about cancer and how certain foods feed cancer. And those are usually the ones we're still eating. Nobody's telling us not to eat them. And if they are, we're saying, oh, I love that. I love that. Well, no, let's not love. Let's love ourselves more to not want to do that. So in my closing, I always want people to know that every single person needs to detoxify their body. And one of the ways to start it, we have a 7-day detox, we have a 21-day detox. And I know people that, oh, I can't do that with 7 days. That means going without the food, right? Or going raw for 7 or 21 days. But I'll tell you where to start. Start with a 4-day. And you can still eat with this 4-day detox. It's called bitters, and it helps to boost the digestion and regulate your appetite and reduce those cravings that get you up in the middle of the night and support your liver detoxification. It helps to eliminate fat-soluble toxins, alkalize the body, reduce gut inflammation, improve the gut. That's the microbiome that Dr. Price was just talking about. But just do something. Whether it's this one, whatever. There's so many. Dr. Bobby Price has some. There are other. You just got to make sure that you become more intentional. When you're walking in the grocery store, become intentional. When you're looking at anything in a box, a bag, a jar, or a can, look at all of the different ingredients. I tell you, some of you heard my testimony. I'm a foodie as it relates to French fries. Used to go to McDonald's, the car would go there on its own. But when I learned that there were about 14, 16 different ingredients in the French fry, that was an eye-opener for me. What do I need 14, 16 ingredients in a French fry? Go buy a potato, cut it up, season it, and put it in the skillet. That's it. All those other ingredients to make it yellow and to make it this, but I didn't know that. And so we're destroyed for the lack of knowledge. So even in the 4-day detox, all you do is boil water, 40 ounces, remove it from the heat, drop the tea bag in there, drink 8 ounces once a day for 4 days, or 4 ounces twice a day, whichever you prefer. I do the 8 ounces at one time because it's bitter, it's nasty, I don't like the taste of it, so I'm gonna get it down, right? And then follow a light protein diet meal plan for those 4 days and watch how that jump starts. Your body will say thank you. So it's not about suffering. It's not about being strict. It's a reset. Because we've been doing the wrong thing for a long, long time. So it's about getting the toxins out of our body to layer. I promise you, you will feel so much better. You'll feel rejuvenated. There'll be a lifestyle change. And it's a journey. It's not a one and done. It's a journey. It's about a mental journey that we start building a new relationship with food and our energy. So look, I so glad you jumped on here, whether you jumped on here live or whether you jumped on through Facebook, whichever way you jumped on here. If somebody guided you to the video, to the replay, tell them thank you. I'm excited for you to be here. We're here every Saturday at this same time, and we'll see you next week for our next session. Bye for now.